Good afternoon, everyone. From Washington, D.C., my name is Andrew Zapfel. I'm a manager for health equity here at NASTAD. Thank you all so much for joining our webinar today. To give others just a chance to log in, we're going to start in just 2 more minutes. Thank you all for your patience. Thank you all for your patience. We're going to go ahead and get started. Again, thank you all so much for joining us today on our NASTAD webinar on U equals U, Health Department Implementation and Opportunities. My name is Andrew Zapfel. I'm a manager for health equity here at NASTAD, and I'll be your host today for the webinar. Before we get started with our speakers, which is our agenda for today, we'll start with introductions and a welcome by our NASTAD board chair, Joanne Morin from New York State. We'll follow by opening remarks by Tim Horn from NASTAD, with presentations today from Michael Carfin in Washington, D.C., and Mariah Wilberg from Minnesota. And then we'll have time for question and answer and discussion. Just some housekeeping before we get started as well. We ask that you please mute your computer microphone or telephone during the presentations. Feel free to use the chat feature, which is available through the webinar bar onto the side, as well as we'll address any of these questions during the Q&A periods. The other options you have available as well, feel free to also use the raise hand feature if you would like to ask a question during the presentations. We'll have time to then open up the line for you to answer your question during the Q&A period. As well as there's also a question feature as well, where you feel free to ask any questions that you would like. And again, we'll have them, our presenters, answered during the question answer period. A recording of the webinar and slides will be made available after this presentation in just a few days. And for more information on U equals U or this webinar, please feel free to contact NASTAD staff members Tim Horn or myself at our emails that are listed on the screen. Our first two speakers today that will be introducing ourselves are Joanne Morin. Joanne Morin currently serves as the director of the New York State Department of Health AIDS Institute. Ms. Morin has been with the AIDS Institute for over 12 years, and the AIDS Institute was created in 1983 to coordinate the state's overall response to the HIV epidemic. Since that time, the AIDS Institute has broadened its mission to include hepatitis, sexually transmitted diseases, services, surveillance, drug user health, and LGBT health. Ms. Morin has served as a board member of NASTAD and is currently serving as board chair for the 2019 to 2020 term. Tim Horn is the Director of Medication Access and Pricing at NASTAD. He works across teams to ensure fair pricing and equitable access to drugs and biologics critical to the prevention and care needs of people living with and vulnerable to HIV and hepatitis C. In addition to the coordination of the ADAP Crisis Task Force, the Ryan White HIV/AIDS Program Part B, and ADAP Monitoring Project Annual Report, and NASTAD's support of the Global Undetectable Equals Untransmittable U equals U campaign, Tim provides technical assistance to city and state health departments to address inpatient and outpatient medication access challenges. And now I'll pass it over to Joanne Morin to welcome us to this webinar today.
Good afternoon, everyone, and thank you, Andrew. I also want to extend my thanks to NASTAD for hosting this important webinar today. So I think, like everyone else who's joined today's webinar, I'm really looking forward to hearing from our presenters from Minnesota as well as Washington, D.C. and hearing about not only how they signed on to the U equals U, or undetectable equals untransmittable community pledge, but also how they have successfully integrated the messaging into their programming and the programming of their partners across their states and jurisdictions. While signing the U equals U community pledge is an incredibly important first step for health departments, what we know is that it's the implementation of the messaging and the programming, as well as education and awareness for people, that is absolutely the priority. We can take lessons that we have learned and that we have observed from those in the community with lived experience, as well as learn from the other examples of those who have moved forward with U equals U. The science is clear as it's related to U equals U. Individuals who are virally undetectable cannot sexually transmit the virus. We need this message to be said loud, to be said clear, and to consistently be said across all the communities that we serve. What we know about U equals U is that it not only is effective in reducing new transmissions, but it is also essential and another milestone as we work across the nation to end the epidemic. It also provides a message of hope for many people, and certainly has the opportunity to assist in reducing stigma, not only among individuals who are living with HIV, but across the general public. Here at the New York State Department of Health, we are very proud of the work and the steps that we've taken as it relates to U equals U. The slide that you see is an example of our campaign, our social media campaign, that includes individuals with lived experience who are willing to share their life experience, share their life stories, and use their faces as a way in which we can continue to endorse and promote U equals U. The work around this campaign was in collaboration with Better World Advertising, and the intention was truly to find a way in which we could consistently and constantly provide messaging through different social media outlets, through community representation, and through an ongoing social media site where we continue to receive messages of hope, messages of lessons learned, and messages of encouragement as we continue to move forward. As the 2019-2020 chair of the NASDAD board, of which I am both humbled and honored, I am responsible for calling a Chair's Challenge. And that Chair's Challenge goes to all health departments across our country. As part of the challenge this year, titled "The Time Is Now, End the Epidemics," I am calling for the doubling in the number of health departments who have signed on as a community partner to the Prevention Access Campaign's U equals U Community Pledge. I'm encouraging all jurisdictions to look at the science and the research of U equals U and find the opportunity to promote and to participate in this important advancement, as we know, related to HIV prevention and care. Of the NASDAD members, we currently have 20 jurisdictions. That includes 14 states, including Washington, D.C., and 6 additional CDC, Centers for Disease Control funded local jurisdictions that have signed on to this pledge. I really encourage everyone that's taking the time today to be part of this discussion. If you have questions or if you have comments, please continue to have a dialogue with the members at NASDAD, including Tim Horn and Andrew Zepfel. And again, I want to thank NASDAD not only for the opportunity to provide these brief comments, but for hosting this webinar and continuing to promote the important work that U equals U has provided us. Thanks to everyone.
Thank you for that welcome. I'll now pass it over to Tim Horn to provide some opening remarks.
Great. Thank you, Andrew, and thanks, Joanne, for highlighting New York State's flagship U equals U messaging, and for setting the stage for Washington, D.C. and Minnesota to showcase certainly the breadth and scope of their efforts. Okay, so importantly, U equals U, as both a vitally important community-led campaign and a framework for health departments to reinforce sexual health, support antiretroviral therapy adherence and supportive services and end stigma, begins really with the best possible news. And that is that not only are people living with HIV who are on antiretroviral therapy and are virologically suppressed significantly less likely to develop HIV-related complications, they also do not sexually transmit the virus to others. Now, the science supporting this is undeniable. 4 major studies, all published in top-tier scientific journals with profoundly similar results. Next slide, please. Okay, so first there was the HPTN 052 study, which found no linked transmissions between 0 different couples in which one partner was HIV positive and the other partner was HIV negative when the HIV positive partner's viral load was undetectable. Then there were the partner and partner 2 studies involving tens of thousands of condomless sex acts with no linked transmissions. There was also the opposites attract study, 17,000 condomless sex acts and no linked transmissions. Next slide, please. What we're left with is zero sexual transmissions between people living with HIV with undetectable viral loads while on antiretroviral therapy and their HIV negative partners. Now, the science here is strong. Again, 4 major studies and many other studies that preceded those really linking, a very low viral load to sexual transmission risk. Additionally, these and other studies demonstrated that viral load blips, sexually transmitted infections, even HIV and genital fluids are not significant to the risk of transmission. Next slide. Now, not only has the science importance of U equals U been embraced by our federal partners, notably the National Institutes of Health, the Health Resources and Services Administration, and the Centers for Disease Control and Prevention, it has been fully recognized by many health departments throughout the United States. Now, here is the Prevention Action Campaign's most recent list of state, county, and city health departments that have endorsed U equals U. Next slide. And here we note that many are NASDAD members. As Joanne noted, 20 jurisdictions in total, with Connecticut being the most recent addition to the U equals U NASDAD family of public health programs. Now, as Joanne noted, she has called as a part of her chair challenge for a doubling of the number of health departments that have endorsed U equals U. And importantly, NASDAD is very excited to work with its members to meet this challenge. Next slide. Now, for most members, supporting U equals U begins with endorsing the U equals U message, which can be found on the Prevention Action Campaign's U equals U website, or u=u.org. Now, as of June 5th, 872 organizations, including several health ministries and the previously mentioned health departments from 98 countries have signed on to share the U equals U message in ways that work for their communities. Next slide. Now, what I'd like to do is end by noting that NASDAD is very much here to help. NASDAD was certainly one of the first national organizations to endorse U equals U, and we currently engage in all levels of federal policy to ensure U equals U remains a cornerstone of our efforts to end the HIV epidemic. One of the things that we do is certainly we catalog state, city, and county member U equals U activities and messaging, and have been pleased to see Minnesota's and Washington, D.C.'s work flourish. And importantly, we provide technical assistance to member jurisdictions, including presentations, site visits, webinars, peer-to-peer and peer-to-partner linkage, along with public health source documents and messaging assistance. And members who are interested in learning more about these opportunities are more than invited to get in touch with myself, with Andrew, at the using the email addresses he provided in his opening remarks. So thank you very much, and I'm looking forward to hearing from Mariah and from Michael.
Great, thank you, Tim, so much for that background. We are now going to introduce our 2 panel speakers for today's webinar. Michael Carfin is the Senior Deputy Director of the HIV/AIDS, Hepatitis, STD, and TB Administration in the DC Department of Health. In collaboration with community partners and regional health departments, He led developing and implementing the 90-90-90-50 by 2020 plan to end the HIV epidemic in DC, establishing a regional project for men who have sex with men of color and transgender persons of color, advancing undetectable equals untransmittable, U equals U, increasing pre-exposure prophylaxis, addressing health equity, promoting non-judgmental sexual health, ensuring access to harm reduction syringe services and opioid treatment, and promoting research and public-private collaborations in eliminating hepatitis C and HIV in DC. Mariah Wilberg was diagnosed with HIV in her teens. Shame, trauma, and self-stigma led her to reject HIV care, and she was diagnosed with AIDS in 2012. Tired of living in secret, Mariah re-engaged in care, became public with her HIV status, and became a volunteer HIV educator in 2013. Volunteering quickly led to a career, and she soon provided HIV education, prevention, and harm reduction services for several community-based organizations before joining the Minnesota Department of Health in 2016. There, she led Minnesota in becoming the third state to endorse U equals U, and now leads statewide U equals U efforts. She was featured in Pause magazine and named as an inaugural 40 Under 40 in public health leaders by the de Beaumont Foundation for HIV activism and work with U equals U. I also like to note that she'll be completing her master's degree in public administration this year. I will now hand it over to Michael Carfin to start the presentation.
Thank you, Andrew. Can you hear me?
I can hear you fine, thank you.
Oh, terrific. Okay, well, thank you for that introduction. It's great to be here with Mariah, and thank you, Tim, for the great scientific background as to on U equals U. And so next slide, I'm just going to talk a bit about our the experience here in Washington, D.C., and first sort of talk about our road to U equals U. In 2016, we released, as Andrew mentioned, our Ending the Epidemic Plan, which we call our 90-90-90-50 plan, which is the similar 90% of persons with HIV knowing their status, 90% of persons knowing their status on treatment, 90% of those persons on treatment achieving viral load suppression, and a 50% reduction in new HIV diagnoses by the year 2020. One of the core elements to us achieving those goals, and that goal of reducing HIV diagnoses, was the construct of treatment as prevention, as described before, specifically that was found in HPTN 052. So our efforts to get people on treatment would then lead to reduced HIV diagnoses. What then led us to U equals U was first really the NASTAD's endorsement, and I can't emphasize as much about how, in particular for us in DC, how NASTAD has been an essential motivator for us to incorporate U equals U. And it was actually at a NASTAD reception where I met Bruce Richmond, who is a force of nature, as the founder of the Prevention Access Campaign and the global movement of U equals U. And we talked at the NASTAD reception about how Washington, D.C. could join this movement. At the time, New York City was the only U.S. Health Department that had endorsed U equals U. And from that meeting and for subsequent conversations, we brought that internally to the Health Department as to gain the support for moving forward with an endorsement. And then we brought that, we're one of the, we've had a history in DC of having our mayor actually have an annual event where she reports our status of our work on HIV. And so we were planning for our next release of data and proposed to the mayor that we would endorse U equals U, and that would be encompassed in our release of our data in 2017. And the mayor gladly, enthusiastically supported that. And then in July of 2017, so basically 7 months later, we became the second U.S. Health Department to endorse U equals U. Next slide. Here's Andrew, your skill set there.
Great. Everyone, this is Andrew again. We will be showing a short video now. You might want to lower your computer volume slightly. We'll start this video in 5 seconds.
And staying on treatment longer. And we are focused in our city on a treatment as prevention approach. And we should all be proud of this progress, but we should double down on our efforts as well. Today, DC becomes one of the first cities in the nation to support new HIV strategy called U equals U, which stands for undetectable equals untransmittable. And through this strategy, we're working to ensure that all residents living with HIV take their medications on a consistent basis. This daily routine will suppress the virus until it becomes undetectable. When that happens, a person living with HIV will not transmit the virus. People living with HIV have long borne the brunt of stigma with this disease. And now we will continue to work to make sure that they are empowered to take the lead on ending this epidemic. So we need your help to get the word out. We want to encourage everyone, no matter who they are, where they live, to get tested. If you're diagnosed with HIV, we want you to seek care immediately. And after you do, you have to take your medications and stay on them. You have every chance to live a full, healthy life and not transmit this virus to others. So I'm going to turn to our doctor now to tell you a little bit more about our efforts. Dr.
So we can skip to the next slide. Thank you, Andrew. So I have to say that being in that room, and I've worked on HIV for 30 years, the palpable excitement of hearing this announcement really was quite remarkable for our community. So then our next steps were really how to translate this into a message that we would share with our community. And we had already done some work around treatment as prevention, and I'll say that's a complicated terminology to get across, and what you're seeing there in that slide is some of the ideas that we had, none which completely worked together, but were some of the ideas around how to communicate this treatment equals prevention. But with U equals U, we moved a step forward in using a terminology that we felt would resonate stronger and would also lead to achieving some of the other goals that we have of reducing stigma, promoting treatment adherence. And then in particular, as has been said, that U equals U is an essential component of our being able to end the epidemic. So the next slide is what we came up with. So here are the components of our messages and the different representations of people in them. And I have to relate, we did, when we were doing the focus groups and testing out this message in particular, at one of the focus groups, we were explaining what U equals U is, and one of the participants, and we had a mock-up of what this ad could look like, and he said, first he had not heard about U equals U, and then upon hearing that, he said, can I take this flyer with me because I need to go out right now and tell everyone I know about this. Next slide. So where we took that message was among different media outlets. We did it on the sides of buses. I know Bruce often talks about how we were out, and this was released at the same time as the mayor's announcement that we were already on the sides of buses and in bus stop shelters in Washington, D.C. We were out on social media and then also through the intranet. Next slide. And then we've, in the past year, last year, we actually launched a new framework of our all of our social marketing on sexual health to embracing a sex-positive framework and how sex is a natural part of life. Our campaign is called Sexual Being. That's how we've branded all of our with our website and with all of our materials. We've created a website that is dedicated to U equals U, and we have these combinations of different messages around how being how they're connected. The next slide shows this is a portion of our U equals U website and the message that we're conveying, including the link to the Prevention Access campaign. Next slide. So in the past year, we've also been looking at how do we make this part of integrate this into our program operations. And we recently, this year, we developed a whole new early intervention services initiative. This is with Ryan White funds, Part A funds, to which we're doing regionally. So Washington, D.C., we are actually the recipient of the metropolitan area. So we're including Northern Virginia, suburban Maryland, and 2 counties in West Virginia, along with D.C. And so we launched this request for applications for funding. And within it, we've encompassed an approach pioneered by New York City of a status-neutral approach. So the program's intention is to serve everybody who comes through the door, and we've related that into this pillars, which we call High Five, or HIV, which are find people, teach them, test them, link them, and keep them into care. And that care is either HIV care or prevention opportunities. And within this, and it's italicized because this is the exact language that's in our RFA, is that all programs must integrate U equals U into their services and communication with clients. So this is a requirement of the funding that we're providing. Next slide. Furthering our efforts locally are to, we have an integrated care and prevention planning group, which is called the Washington, D.C. Regional Planning Commission on Health and HIV. And they're in the process of developing a U equals U white paper that will set the context for the next step of their work, which is to add U equals U to all of our, typo there, all of our Ryan White service standards. And that process is underway. We have a form led by our chief medical officer. We have a biomedical work group of providers, which works across HIV care and prevention. And through that, we're in the process of developing more education for providers, as well as academic detailing, which we've been doing for many years in DC, but developing a new approach around reaching to providers at their clinical locations. And then the 90-90-90-50 plan, we're in the process of updating that plan, of which we're going to focus in on key strategies to sort of accelerate our efforts to end the epidemic in DC. And one of those key strategies is the scale up of U equals U in our program approaches. And so we're forming an internal work group around U equals U. And then over the summer, we're going to be having community consult engagement to get from community members and community partners recommendations to how we could scale up U equals U and make that a standard of our care here in the district and in the metropolitan area. And the next slide, I think I'm about on time, is a thank you to the team here at the Department of Health. Also, we have an amazing collaboration with our partners in Maryland and Virginia. So shout outs to Peter DiMartino and Diana Jordan from Maryland and Virginia, respectfully. They have been integral in our development of our regional RFA. And then also our advertising firm that we use is called Octane, a local firm. This is really our message, and something that about trusting the science and not stigma. So thank you.
Thank you, Michael, so much for that presentation. Before we hand it over, I want to just give a quick plug. We will have time for questions at the end of this webinar. So feel free to use either the question feature, where you can type in your question. I will read that out for our panelists to discuss, as well as you can also use the raise hand feature, where I'll be able to then unmute your microphone and you can then ask your question for the larger audience. With that, I will pass it over now to Mariah to give her discussion on U equals U in action.
All right, thank you. Thank you, Andrew, Joanne, Michael, Tim, and everyone at NYS for inviting me. And a big thank you to everyone watching the webinar. Can you advance the slide, please? Sure. All right. So apologies to Connecticut. You didn't make it onto my slide, unfortunately, but good to hear that a state recently joined. So just a little bit about the process of us endorsing U equals U in Minnesota. It took us having conversations for the better part of a year, and we did have a small team of U equals U champions that shared news and journal articles related to U equals U with our key decision makers. A lot of the conversations focused around the appropriate language to use and also what key messages we needed to deliver when discussing U equals U. So the rest of my presentation is going to cover how we've implemented U equals U, but I've also created a one-page resource for folks who are currently in the process of having those discussions about whether or not to sign on. It kind of covers the process we went through in Minnesota and different ways to frame U equals U to increase buy-in. So shoot me an email, that'll be included at the end of the presentation if you're interested in that resource. Okay, so our efforts around U equals U, and please enjoy these pictures of actual folks doing the work here in Minnesota. So our efforts around U equals U have been focused on 4 different audiences. So the health department category is really about your internal stakeholders. And then partners could be folks providing HIV care and prevention services directly to clients, or more broadly, it could be anyone working with people living with or at risk for HIV. And then community members is going to be folks living with HIV, folks that are vulnerable to HIV and communities most often impacted by HIV. And then again, with providers, you'll probably start your efforts with your HIV specific infectious disease providers, but we also want to make sure our GPs and other more general providers have the most up-to-date information about HIV. Next slide. Thank you. So we'll start with our first audience, and we'll talk a little bit about the steps after signing on and how we've implemented U equals U into our work. So this photo is from a recent press event for our, oops. Yep.
Apologies.
No problem. This photo is from a recent press event for our long-term plan to end the epidemic and HIV-MN. And I'm really happy that promoting U equals U and fully benefiting from both the individual and public health benefits are a big part of the plan. And we did several years of community engagement leading up to this plan, and U equals U was a recurring theme out in the community, so it felt really good to have that reinforcement that we were on the right track and that the community was excited about Minnesota teaching U equals U. Next slide. So after we signed on, we knew that the first step would be making sure everyone was up to speed internally, just so that everyone feels confident promoting U equals U and that everyone will be using consistent messaging. So we visited different programs and units with like a standard presentation, which covered the U equals U basics and how it works, the evidence supporting U equals U, key messages, and why promoting U equals U was important. We tried to think out of the box and visit programs that aren't usually associated with HIV, but that might have some overlap, either with programming or constituents. And during every training, we asked how this new information could potentially change the work that folks were doing. Next slide. So during these trainings, we compiled every question that was asked of us, and us is myself and Kathy Chin, my colleague from the prevention unit. And we used those frequently asked questions to create a key messages and talking points document that we shared internally. We also put other resources out for folks, including graphics, the slides, links to relevant studies and journal articles, the language guide from Prevention Access Campaign, and a summary of the U equals U campaign for our partners. Next slide. So looking at some of the ways we've integrated U equals U into our work, we've added U equals U education as a standard requirement of our grantee work plans and progress reports. It was integrated into the section where they share their strategies, successes, and challenges with doing other like STI or STD and hepatitis education. We added a U equals U section to our HIV testing training, along with adding it to our new grantee onboarding. And then we also added U equals U language to our care continuum messaging, so that every time we're talking about how we're doing with viral suppression as a state, we're also talking about viral suppression as a prevention strategy. Next slide. So another large project that's in progress is updating our partner and care link services, policies, and procedures. So we know that these are based on the old understanding that condomless anal and vaginal sex is an HIV exposure, and which we now understand not to be the case. So we're currently taking a look at all of these to operationalize the science of U equals U. And we're also creating a disclosure guidance document that educates about U equals U. So this is for healthcare providers that have questions about whether they have an obligation to disclose a patient's HIV status to partners that might not be aware. Next slide. So you're also going to want to do a thorough review of your online and print materials to make sure they accurately reflect the current HIV science. So along with modifying or creating presentations, trainings, slide sets, what have you. Next slide. And here's an example. This comparative matrix was created for use in our HIV testing trainings. So the overall message here is that HIV prevention is a toolbox. And as a health department, it's our responsibility to promote all of the evidence-based HIV prevention methods. So we're not promoting U equals U instead of condoms or PrEP instead of U equals U. Rather, we are providing scientifically and medically accurate information along with factors to consider so that people can practice autonomy and make the decision that is right for them and their partner or partners. Next slide. So shifting to some of the education we've done with our partners here in Minnesota. Next slide. Right away, we created a U equals U summary to let our partners know that we signed on and more about the campaign. We had two versions, one more general one for grantees that are not HIV specific, and then a more thorough version for our HIV grantees. Next slide. We also started doing partner education shortly after signing on, and we tried again to think of partners that may not immediately come to mind when considering HIV. And this partner education is ongoing. I didn't want to, fill several slides with it, but this is just a sample. Next slide. So shout out to our awesome partners doing the work here in Minnesota. We've got from left to right, Cree and Spencer from the Youth and AIDS Project, And Matt is the executive director of Liveness Project. So we've heard a lot of success stories from our partners and community members. Everything from how U=U has changed their life personally, from them doing spur of the moment U=U education in airports. Next slide. So something on the horizon, we're really excited. We're gonna do a one-day U=U summit and bring out my hero and mentor, Bruce Richmond, to keynote and help with the summit. So I'm currently working on a U=U needs assessment survey to send out to our partners and providers, and that will inform the direction we take with the sessions. And we are considering possibly doing tailored breakout sessions for different types of professionals. Next slide. So looking at our community education, we promote U=U at all the community events we attend. From left to right, this is Maddie, one of our disease intervention specialists, and Emily, a fellow communications specialist. And also at that event, I did present on U=U. So just a note, Minnesota is a state where our health and human services are separated. So sometimes this can, you know, affect how much money we do have available to do large scale campaigns. Next slide. So we did our public rollout of U=U on World AIDS Day 2017. This gave us several months to build a social media team that wanted to help share the message on World AIDS Day. So then I created an email list during partner trainings and sent out a social media kit with sample posts and messaging ahead of time. Next slide. Here are some overall analytics for U=U posts on social media and some screenshots of our posts. Shout out to positiveseries.org, which is where we got the video to share on the post on the right. If you haven't checked them out, please do. They have videos of real people's stories and customizable posters and other campaign products that have been translated into several languages. And there's a space for you to add your logo and your organization's information. Next slide. All right, this is our Metro Transit ad campaign that was up in our entire St. Paul, Minneapolis metropolitan area for about 6 months, including during the Super Bowl in 2018. When selecting the scope of the campaign, we actually used our EPI data, zip code data, and overlaid that over the maps of the different transit routes. And you can see we had over 5 million impressions. Next slide. So what we're currently working on here at the health department is a combined U=U and PrEP campaign that will use real people's stories and videos. So we really want to make sure that we're hearing directly from the communities and also those people doing frontline work about the best way to communicate U=U. So the campaign is being produced in cross-sector partnerships, and those are examples of some of our campaign partners, informed by a paid advisory board, and it's also going to be unbranded. So the decision to do an unbranded campaign was twofold. One is that some of our communities most impacted by HIV have a historical mistrust of government. And secondly, removing the logos also helps to remove the egos from the equation, which promotes collaboration and shared ownership. So this campaign that's in progress will be debuted around World AIDS Day this year. Next slide. So lastly, we're going to look at some of the work we've done with our providers. Next slide. So one strategy has been to publish articles when the opportunity comes up. The first pictured article was in Metro Doctors, which is more of a general healthcare provider audience, and it covered both U=U and PrEP. So my advice is that if someone reaches out for PrEP education, whether that be an article or presentation, ask them if they would also like current info on the other new biomedical HIV prevention method and vice versa. So PrEP and U=U are not at odds. They are both highly effective and appropriate for different situations. And the other article was published in HIV Specialist earlier this year. Next slide. So one thing we noticed when talking to folks out in the community was a lack of consistency about whether or not healthcare providers were discussing U equals U with clients. So after meeting with the talented local team at the Midwest AIDS Training and Education Center, we decided to do this survey, which actually started as a homework assignment of mine. And we also decided to open it to the entire 10-state Midwest region in the hopes that we could help out our neighboring states. And the results will inform future capacity building with HIV clinics, our ID specialists, and other allied health professionals. And the survey covers provider knowledge and beliefs and patient characteristics that are influencing whether or not these conversations about U equals U are happening. And then it also has message testing, argument rating, and qualitative sections. Next slide. So just to give you a sneak peek, and sorry, it looks like my formatting got a little bit wonky, but this question here is about whether providers trust HIV treatment as prevention or U equals U, even in the absence of condoms or PrEP. And as you can see, over half, or 57%, either agree or strongly agree. There's still a lot of work to do. So we'd like to see that number closer to 100% because we know the evidence supports it. Next slide. So if you are coming to USCA, please attend our session to learn more about the survey and see the full results. We're also going to distribute the results on the Minnesota Department of Health website through the local AIDS Training and Education Center listservs, the NASTAD listservs, and submit for publication in HIV Specialist magazine. Next slide. So moving on to opportunities, I highly recommend integrating U equals U into your standard presentations. Some of the ones we've done have been the toolbox approach to HIV prevention, which touches on condoms, testing, PrEP, and U equals U. And another one is a new era of HIV prevention, which focuses on both biomedical approaches. You use U equals U as a hopeful message that can promote adherence and staying in care, and try to work with both within the health department and with your partners to have a unified message. Reach out to your HIV doctors in your jurisdiction to get a sense of where they're at with this, and do community education integrated into your trainings for partners and grantees. And then finally, if your jurisdiction has peer navigators, you'll want to make sure they're up to speed so they can share the happy news. Next slide. So barriers, U equals U has come with a lot of challenges, as does any new or innovative thing. Primarily, this is a lot of work. I really recommend prioritizing U equals U in terms of both financial resources and staff time. There's definitely enough work to warrant integrating U equals U into multiple positions and work units. It's not just a messaging campaign, it is the future of HIV prevention. And because it's so new, people living with HIV can be getting a lot of consistent or inconsistent or conflicting messaging from public health, healthcare providers, case managers, etc. And then finally, you want to take a look at the language you're using and make sure that it isn't outdated, and also give some thoughts to how your messaging will translate if you plan to do U equals U education in other languages. Next slide. So thank you, and I challenge each one of you to go forth and be a champion of this stigma fighting message. As a person living with HIV, I can't even begin to describe how much this has changed my life and how I feel about myself and how others feel about me. And another thing is, you don't have to be in a formal leadership position to lead. You just need the passion and dedication. So please get in touch with me if you have any questions, either by email or on LinkedIn. And I love connecting with all my peers and colleagues and fellow community members. So thank you.
Thank you so much for that presentation, and thank you for your time. So now I'll open it up now to questions. Again, if you would like to ask a question, feel free to either type it into the chat feature or raise your hand. I'm going to now go through the questions that we have now for our speakers. One moment. And And let's see, to start us off, I guess the question for both of you will be, and Michael, you touched on this a little bit, how do we use the language of undetectable and have people understand that what we actually mean is viral suppression, or less than 200 copies? The studies use that as the threshold rather than being undetectable. To be undetectable, you actually need to be under the lower limit of detection of a test, which is much lower than 200 copies. And keeps lowering all the time as better testing is developed. So the question is, how do we make sure our language really defines what we mean by undetectable and what we mean by viral suppression?
Thanks. That's a really good question. So we've obviously we've adopted the U equals U framework message line, but when we talked about and in our messaging, we talk about taking the medication and achieving viral load suppression. So we do kind of straddle both, and I think certainly as Mariah has highlighted, is that this is a conversation starter, and that there's the opportunity to engage that. But I do think that it does need to be clear. There are these questions that people have raised about durable viral suppression, but I think our approach has been that we need to have some of these are one-on-one conversations, and that's where we need to be doing education with providers and with community-based organizations to get that correct information out.
And just to add a little bit, it really depends on who the audience is, how much depth I feel needs to happen regarding the nuances between viral suppression and being undetectable. But I usually just tell people that like virally suppressed equals untransmittable isn't catchy, but for the purposes of preventing sexual transmission, they're used interchangeably in this campaign.
Great, thank you for those answers. So the next question here is, Mariah, might be something you can really help us with. Have you received any pushback or confusion from providers with the language that you currently use in your campaigns and language others use, such as CDC's effectively no risk language? You could talk a little bit about that.
Yeah, that's a great question. So we are still having internal discussions to somewhat broaden the language for use in our campaign. One of my main concerns is how this will translate. So we do, those discussions are ongoing, and I am hopeful that by the time we are ready to debut our, our combined campaign this December, that we will have a little bit more flexibility. I think sometimes whatever the CDC says is just kind of the model, but personally, I would prefer to have a bigger number of ways to describe it. But I've not received much pushback from providers. Mostly it's community members, to where the effectively no risk might be murky. So I usually just follow that up with like talking more about the studies and saying there's never been a single case in the history of HIV, and just providing more of that context.
And I think the same really on our part. I mean, I also point a lot to what the NIH has said, because they've been much more precise and clear about U equals U. So though it's great to have the CDC on board, it does get a little bit sometimes a little convoluted. So I think part of what we're planning to do as well is to have some of those kinds of conversations with our community to be able to unpack all of those different definitions and what works most effectively for our community here.
Thank you. We actually have quite a few questions now coming in. I think there's been a great excitement from our audience on these two presentations. This next question first starts with great work to both DC and Minnesota. The question first is for DC. They notice the DC ads state, if you're undetectable, you won't transmit the virus to others. When talking about consistency in messaging, what was the decision to have that as a statement versus something along the lines of, you won't transmit the virus to others through sex, making it very clear what transmission we're talking about with U equals U?
So when we started this, and we did test these messages with community members, we tried to make the message as clear as possible, make the message as compact as possible. We did decide that our images would always have two people in there, so that there was a implicit aspect that this was a sexual, that this has to do with a sexual connection. And then in our new iterations of campaigns, we talk, there's a lot of references to sex throughout our framework. We are looking at, again, as to not keeping this static, is to then talk through some more messages again as to make it, to make that more precise around sexual transmission. But we were starting off basically with very little other references, so that's what that was what our community feedback was in phrasing it that way.
Thank you for that. The next question is for both of you. Looking to see how do each of you measure impact of the U equals U campaigns that you are leading? Not so much in process indicators, which has gone through, but really looking at impact and what are your hopeful impact and outcomes of the campaigns as you move forward?
Well, as I said, part of our whole ending epidemic plan is that when we see our reductions in new HIV diagnoses, that effectively U equals U is helping to drive that. It is the cornerstone when we've actually modeled our numbers in terms of getting to the 50% reduction in new HIV diagnoses. 85% of that we've attributable to treatment as prevention, or U equals U. And then the other 15% is coming from PrEP scale up. I think one of the other areas that we're looking to develop a measure and been looking at some other metrics is around stigma. There are some stigma indexes out there, and to be able to measure the impact of U equals U in terms of, we've certainly got that qualitatively. We've gotten that through many focus groups and other conversations with community about how powerful the message is, but then how to translate that in terms of a more outcome measure.
Yeah, and just to add some stuff from Minnesota, so the current campaign that's being produced, it is being produced, like I said, in those cross-sector partnerships. And what that looks like is different work groups. And one of our work groups is the planning and evaluation. So they're currently working on an evaluation plan for the campaign. And we also have the Center for Public Health Practice here at the Health Department as a resource. And then looking at some of the provider side, we are planning on doing pre and post evaluations at the minimum for our one-day U equals U summit. And then after spending time doing some capacity building, Maytech, and we are open to the possibility of possibly doing a follow-up provider survey in the future.
Great, thank you both. Thank you both for that. We are coming towards the end of the hour, so I just wanted to give a special thanks to our two speakers, both Michael and Mariah, for sharing the great work that DC and Minnesota are doing. I also want to thank our welcoming speaker, Joanne Morin from New York State, as well as Tim Horn from NASTAD, providing us some of that scientific background before our panelists spoke. As just a follow-up, if there are any specific questions after that you would like addressed, please feel free to reach out to NASDAQ staff Tim Horn or myself. Our emails are located on the screen. Again, we wanted to thank you all so much for your participation today. And as always, we look forward to supporting all of you in your efforts to implement the U=U message. Just note this webinar will be recorded and will be sent out over the next few days. And we thank you again so much for your questions, your time. And again, thank you so much for those who spoke on our webinar today. I wish you all a great and wonderful rest of your week. Thank you so much for your time.